Gulf Cooperation Council states delivered a sharp rebuke to Iran at the United Nations today, formally condemning what they call systematic violations of their sovereignty. The six-nation bloc, including Saudi Arabia and the UAE, presented evidence of Iranian attacks to the UN Security Council, demanding immediate international intervention. UN Human Rights Chief Volker Turk warned of grave repercussions as the conflict with Iran continues to escalate, calling the situation a threat to regional stability. The formal complaint marks the most unified Gulf response since hostilities began, with member states coordinating their diplomatic strategy through established channels. This represents a significant escalation in diplomatic pressure as Gulf nations seek multilateral support against Iranian aggression. The timing coincides with ongoing military operations and growing international concern about the conflict's broader implications for global energy markets and Middle Eastern security. International observers expect this formal UN engagement to intensify calls for ceasefire negotiations. A groundbreaking 3-year study published in Pediatrics provides definitive proof that COVID vaccinations during pregnancy protect newborn babies from the virus. Norwegian researchers examined thousands of births and found clear evidence that maternal vaccination creates protective antibodies that transfer to infants, offering crucial immunity during their most vulnerable months. The comprehensive study tracked mothers and babies from 2021 through 2024, representing the most extensive research on pregnancy vaccination safety and efficacy to date. Results showed significantly lower infection rates among babies whose mothers received COVID shots during pregnancy, with no adverse effects on birth outcomes or infant development. This research addresses lingering concerns many expectant mothers have had about vaccination during pregnancy, providing scientific backing for public health recommendations. The findings come as health officials worldwide continue promoting vaccination programs, particularly for vulnerable populations. Medical experts expect these results to increase vaccination confidence among pregnant women and influence updated guidelines for maternal care protocols globally. A major hospital waited 2 full days before alerting health authorities about a developing meningitis outbreak, potentially compromising patient safety and outbreak containment efforts. BBC investigations reveal that medical experts are calling the delay completely indefensible, arguing it likely hindered rapid identification and response protocols critical for managing infectious disease spread. The hospital's delayed notification violated standard public health procedures requiring immediate reporting of suspected outbreak situations, particularly for serious conditions like meningitis that can rapidly become life-threatening. Health officials confirmed the wait period allowed additional exposure opportunities and complicated contact tracing efforts essential for preventing further infections. Multiple patients were potentially exposed during the critical 48-hour window when isolation measures should have been implemented. This incident highlights ongoing concerns about hospital reporting protocols and institutional accountability during health emergencies. The case is now under formal investigation by health regulators, with experts demanding systematic reviews of outbreak response procedures to prevent similar delays that could endanger public health in future infectious disease situations. Democrat Emily Gregory scored a stunning upset victory in Florida's House district encompassing Donald Trump's Mar-a-Lago resort, flipping a previously solid Republican stronghold in what analysts are calling the latest warning sign for GOP midterm prospects. Gregory's victory in the special election represents a remarkable political shift in a district that has reliably voted Republican for over a decade, including strong support for Trump in recent presidential cycles. The win continues a pattern of Democratic overperformance in traditionally conservative areas ahead of November's crucial midterm elections, suggesting potential broader electoral momentum. Local issues including healthcare access and economic concerns appeared to resonate with voters more than traditional party loyalty, according to exit polling data. This Florida result follows similar Democratic gains in unexpected territories nationwide, indicating possible vulnerability in previously safe Republican seats. Political strategists from both parties are closely analyzing the outcome for insights into voter sentiment and campaign messaging effectiveness. The victory provides Democrats with renewed optimism while forcing Republican leadership to reconsider their electoral strategy in supposedly secure districts. A comprehensive analysis of President Trump's own words reveals the evolution of his administration's approach to the ongoing conflict with Iran, providing insight into decision-making processes that led to current military operations. The compilation of presidential statements, speeches, and social media posts traces the escalation from diplomatic pressure to active warfare, showing how rhetoric transformed into policy over recent months. Trump's public declarations demonstrate a consistent pattern of increasing confrontational language toward Iranian leadership, culminating in authorization of military strikes against Iranian targets.